We are glad to introduce to you ray.healthray.com. This is the login page for our new EMR software at Ashok and Ashokan hospitals. So when you go to this site, you will get this option for doctors and for nurses. As a doctor, you can put in with your login credentials and login. When you log in, you can select the organization. Now I am Dr. Matthew, and since I am sitting at Ashokan Hospital, I am going to select Ashokan Hospital as the place where my patients will be there. And as soon as you enter there, you will see that today's appointment schedule where the patients who are waiting for you will be seen. And if you notice closely, these patients have this brown line next to it, this brown strip which is there, and some have red, some have blue. So these are the different types of patients who are there in today's appointment status. So if you see here, waiting 2, engaged 1, check out, and the others, you have filters over here whereby you can just check out who are the waiting, who are the pending, and there are some engaged patients as well. So you can see these patients. Now if you click on any of the patients, as soon as you start the consultation, you will notice this window opening up like this, in which we have managed to get the past history of all our patients from the previous software. This is one of the great advantages of this Healthray, that at a glance you can see the previous visits of this patient. For example, this patient Minal Milind Shinde, she had come on Saturday the 25th of October, and these were her complaints. These were the test results which were there, and this was the drug advice which was given, and everything is visible at one glance. The visit before that was on 16th of September, in which her weight was 67.5 kilos, BP, heart rate, HGT was done. Everything is beautifully transferred from our previous software. So we have over 65,000 patients whose data has been transferred to Healthray to enable us to give better care to our patients. Now this patient, for today's visit, these are the symptoms. So if the patient says they got cough, then we can write the duration, 2 days, and you can mention with expectoration, and you can keep it. Severity also you can write if it is mild moderate. So this is a template which is designed for a physician, which I have designed for myself, but you can customize this entire page depending on how you want to see the clinical examination history and other things. We also look at the vitals. So here we enter the weight. You can enter the height optionally, so that the BMI is automatically calculated. Then you can enter the BP, systolic or diastolic very easily. The heart rate you can enter the SpO2. It's all by one-click method. And here you can see that the RMOs have already entered the reports of this patient for me. So for the consultant, it becomes very easy. The patient's history and investigations which are done have already been entered, so that when the patient comes to me, I have to just write here. Now these are the things. Some of the text, there are free text entries for the drug advice, where the previous, some medicines which are not in our formulary were entered over here. That's why they will be seen here. And then the ones which are in the formulary are seen over here. If you want to add a new medicine over here, you can just go here simply, and you can start typing, for example, capsule bacosules. So when you click there, also you see the number 60 are there in our pharmacy. So it's very easy to write, decide which medicine you want to give. You can write here after lunch, frequency daily for 30 days, then it comes. Now automatically, if you notice, based on this duration of 30, the next follow-up date has been calculated over here as 8/1. At the same time, you can also select the follow-up date by selecting here. Suppose I want to say that 6 weeks. So 6 weeks, then the follow-up comes on Tuesday, 20th of January. That's all. So easy it is to write this. Plus we have templates for general advice. We have some templates which are already saved by me. For example, patients who have allergy. So I clicked on that. If I want to add some more templates, I can again go here, display the group. There is a group of general advice which is there. For example, some of my patients who have memory issues, I have written a template for that. You can create your own templates for your own patients. And I can copy this over here. It will get added over here. So the memory, these things. Now after this, when I click on the print button over here, It also shows you how many follow-ups are there on the day when the follow-up is scheduled. Then you can, the other beauty of this is that this thing is beautifully formatted like this, and you can select the language English if the patient's instructions are to be given in English, and then you can give a print command, or you can also send by WhatsApp to this number. You can directly send this prescription by WhatsApp to the patient. So this is in short the introduction to Healthray software, and I hope that you will enjoy it and keep using it to improve the patient care and whole person care to our patients. Thank you so much.